with using a Q-tip, we're just going to apply a little bit of adhesive here on both sides, because I want to have this bite registration record be stable on the lower bite block. I don't want this to come off. Also, with the fact that I've cut the box rather nice and square and very sharp, it will help that little index stay in there a little more secure. So I'm just going to air dry that a little bit. Now, one thing you can also do, which I haven't done up to this point, just to help you hold the lower bite block a little more secure up against the mandible, typically what I'll do, I'll create a little notch right here on each side around the 6 area, and that will enable me to put my index finger in here as well as hold the mandible from the bottom. Okay, so I'll do that on both sides. You can certainly do this when you do the protrusive as well. I didn't do it before, but I'll do it now. All right, so we're ready to go. Get you to put your head back for me, nice and relaxed. And this time around, Robert, I am going to ask you to close down with your back teeth. So find those notches that I scored. Nice and relaxed for me. Close down with your back teeth. The other way. Open. Relax your jaw. Back here. Very nice. Open again. Relax and close. Very nice. Open again. Relax and close. Open again. Close your eyes for this one and close with your back teeth. Very good. So he seems to be very repetitive in terms of his centric relation. Get you to go a little more upright. Good. Open again. Relax for me again and close with both sides, okay? Both sides. Good. So the midlines are lining up. I have the same little more excessive overlap, horizontal overlap on the left and the right, which is the same as before. Get you to open again, relax for me again, and close. Good. All right, so just like last time, Robert, I'm gonna inject some more material on both sides, and you're gonna close down and hold it there for about 10-15 seconds, okay? So let's practice that just one more time before we do it. Nice and relaxed for me, and close with both sides. Open. Can you roll your tongue back for me? Towards the back of your throat and close. Good. That's another technique you can use. You can have the patient roll their tongue back, but not excessively. Also, open for me again. Give me a big smile and close. That's another way of getting them into centric relation as well. Open again, smile and close. Good. Perfect. Okay, open again. So wait for me. This time we're just going to put it on the box itself, nowhere else. Nice ample amount. Smile with your back teeth and close. Back teeth. Nope. That's okay. That's okay. This is not the correct centric relation, but we'll do it again. But before we do it, we're just going to let the material set. So what you did there, you came forward. Because you've been practicing that for the past 5 minutes, right? So, and that's quite common for the patients to go back into protrusive, then going back into centric relation. So I'm just going to get you to open gently for me. Open. That's all right. We're going to take this out. Relax your lip and get my finger in there. There we go. Okay, so we're going to remove this. And I'm going to apply a little more adhesive before we go any further. And we're going to practice with Robert one more time before we get him to go into centric relation. So I'm going to put a little bit on the side because the material will spill over just a bit, so we can capture that. Try that a little bit. Okay, head back for me again. Get you to open, nice and relaxed for me. Good. And close with your back teeth. Other way. There you go. Perfect. Right there. Open again. Back teeth. Perfect. Okay. Let me see if I can get this a little more upright for you, Robert. Raise your head for me. Head back. Good. Open for me again. Relax your jaw and close. Open again. Close back here. There. Open again and close back here with this part of your jaw, okay? You're doing a good job. One more time. And relax and close. Good. Change the tip. Nice and relaxed for me. Relax your jaw first and close. Back, 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 back. Move your jaw back. Back, 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 back. Good. Stay right there. Relax your lips together. Good. I think I have it, but we're going to remove it in a bit. We're going to cut off some of the excess material. We're going to place it back in Robert's mouth, and we're going to get him to go into that position. If he repeats that index, going into that index time after time, that is his most repeatable centric relation position, okay? At a given vertical dimension. Stay right there. You're okay with that? Mm-hmm. Good. Okay. Mm-hmm. That's okay. That's okay. Slowly for me. Open now. Open. Good. Everything should come out together in one piece. Just like that. Very good.
Right here.
Yeah.
Seems like it's sticking out a little too far. Like
this one here.
Yeah, right here.
Okay. That is just a matter of just reducing it to your comfort level.
Okay.
And we can do that at the next appointment at the try-in, or we can do that at the finish.
Okay.
Not a problem.
Cool.
Okay, so that looks pretty good. The midlines are lining up again. There's that overlap that's a little more evident on this side than it is on this side. But nevertheless, it looks good. There's no interference in the back. But what I'm going to do next, I'm going to pry this open carefully. And we want the bite registration to stay on the lower. So we have a nice index of the keyways on the lower. And right about here, what I'm going to do is cut off this excess material. Don't need this. All I want are the keyways completely to assess if Robert is able to repeat this position. If he's not able to repeat it, then I got to do it again. If you don't get this right, hopefully you'll pick up the error at the try-in stage. And if you do, that will cause you a 7 to 8 hour reset and re-wax. If you don't notice it at the try-in stage, you're probably going to notice it at the insertion stage. And if you notice it there, you're looking at a remake. So take your time with this. So this is all I want. I just want the keyways, nothing else. Notice I did not have any material in between the two sides here. That means I didn't open my established vertical dimension of occlusion. Okay? So we're going to rinse this off a little bit. And let's see if Robert is able to repeat into this index. And if he does, then I'm comfortable enough to say we're almost done for the day. That's a good sound. Nice and relaxed for me. And get that into a nice positive position and relax and close. Open and close. Open and close. Open and close. Open and close many times on your own. There we go. So he's going into that same index pretty comfortably, Robert.
Mm-hmm.
No interferences.
Mm-hmm.
Okay, and hold it for me on the last one. Open again. Now, if I push the patient back, that's not unstrained. I'm straining them into centric relation. And a lot of people make that mistake where they push the patient back, they ask them to close, and then they don't fit in that index. But I want the patient to go in there comfortably on their own. Close, open, and close. Open and close. I think we have it. Okay, open for me again. There we go. Take that out.
Are we done?
We're almost done. The last thing we're gonna do, Robert, is it's pretty fun. We're just gonna select a color for your teeth.
Oh.
Okay? Stop for me. I gotta get